Hi, welcome to Dr. Gao's classroom. Today, I get a special guest, Dr. Rey Tiquia. He is an excellent traditional Chinese medical practitioner. He studied in the best traditional Chinese medical university in Beijing. He has been practicing traditional Chinese medicine for many, many years. He also published research papers and books in traditional Chinese medicine. So today, I'm going to ask a lot of questions about the theories and practice of traditional Chinese medicine. What I hope to achieve today is to help you to have a better understanding of the theory and practice so that you would get more out of your consultation with a traditional Chinese practitioner. Or you could take better care of yourself, informed by the theory and practice and experience of Dr. Rey Tiquia. Okay, Dr. Rey, can you tell me how many years have you been practicing traditional Chinese medicine?
Um, Thanks for your kind introduction, Professor Gao Yin. Well, I have been practicing traditional Chinese medicine in Melbourne for the past 40 years.
Wow, wow. Um, how many patients do you see in your business time, like per day?
Um, Look, it varies. Today, we are just coming out of the COVID pandemic
Yes.
here in Melbourne. And during 3 years in interregnum of the COVID pandemic, you know, I was open, but most of my patients were not coming.
Oh.
They were all, confused about what was happening at the time. And it was only recently that I have been receiving calls from my old patients.
Yes.
So to put it more in brief, I see patients probably around 4, 5, 10 patients in a week.
Oh, right, right,
Yeah,
right.
and also at the moment I am in a state of partial retirement.
Ah, yes, yes. So you actually have more time for each patient.
Yes, but having more time with each patient is an added sort of way that I have been seeing patients for the past years in Melbourne even before the pandemic.
Mm.
Generally, I spend probably 30 to 45 minutes in
Wow,
seeing a patient
wow.
because um, you have to assess the condition of the patient, make a diagnosis of the condition based on traditional Chinese medicine, and then work out what sort of treatment that
Yes,
you can give to a particular patient
yes,
based on that diagnosis.
yes. So what do you look at when you see a patient? Like what kind of sign and information you'll be gathering, like a kind of question you ask to your patient?
That's a very good question, Professor Gao. In Chinese medicine, before we make a diagnosis, we we have to um, deploy a system of examining the patient, which in Chinese is called Suzhen,
Oh, yes.
which is actually Wang Wen Xie,
Oh,
which
yes.
actually means you have to observe the patient, which is Wang. You have to deploy some questions, give some questions to the patient to understand the history of the condition. That's the when, and then the when you have to use your olfactory sense and
Yes.
to work
Yes.
out um, the smell of the atmosphere and that sort of thing.
Oh, yes. Can I interrupt? See, this one is very important because it means both listening in and smelling.
Smelling, yes.
So you will be like closely listening to how the patients talk and
Yes,
his voice,
yes.
and sometimes smell a bit of body odor.
Not only that,
No.
not only the body odor. You see, sometimes if a patient comes with the gunmouth or
Oh yes, like a
upper
cold.
respiratory
Yes,
tract
yes.
infection, you can actually smell some
Like a
the smell of
bread.
the mucus and the breath or something like that.
Oh.
So you would know whether the patient is having a, a a heat condition or a cold condition.
Oh. Oh.
So the realm of wending or smelling
Yes.
is really very wide.
Wow.
And then
Wow.
the last one is the qie.
Yes.
Qie is to, well, the English translation is to palpate, but basically it is to feel the pulse
Yes.
and then also
Oh,
to
to
touch
touch the
some
bodies.
body
Ah.
surfaces where the flow of the qi runs along the meridians of the body on the surface of the body.
Oh,
So
right.
touching is very important
Yes.
because you get in touch with the chi, with the life force of a particular
I would
patient.
ask certainly more question about the qi. So the next question actually was closely related to this is that if someone just show up in your clinic, they know absolutely nothing about Chinese medicine or all this theory or whatever. They just heard from a friend. Oh, so and so very good. You did this for me and it was good. So they come up to your clinic. How do you explain what you're going to do? Like, the Wang Wen Wen Qie, as well as, the symptoms that you're going to ask.
Yeah, that was a difficult problem for me
Yes.
40 years ago when I started practicing in Melbourne.
Yes.
Because here in Australia, most people are only aware of Western medicine.
Yes.
See,
Yes.
so when they come to see me at that time, um, they would ask me, they would try to know, they will tell me what they're suffering from in terms of the diagnosis of a Western medical practitioner.
Yes.
So they will say that, well, I have hypertension,
Mm.
I have sciatica, and
Mm.
that sort of thing. So at the time, it was difficult because I had to translate in my mind exactly what those conditions are in terms of the language of traditional Chinese medicine.
Mm.
Like the case of sciatic nerve problem. Now I can see that if a patient complains of some pain on the hips, on the back, that runs through the side of the
Oh, yes.
body,
Yes. Yes.
well, I would know when I would know if I ask some questions about the where the patient is suffering from the pain, whether it affects the gallbladder meridian
Yes.
or the spleen meridian, which runs along the lower
Oh.
extremity.
Yes, this is the gallbladder and kidney meridian is going this side. This is,
Well, the gallbladder is on the side of the
yes.
leg,
Yes.
and the kidney meridian and the urinary bladder meridian runs
Yes.
on the back of the leg.
Oh, so you will ask specific
Yes,
positions where the pain kind of
yes.
goes along.
The same
Oh,
is true with hypertension.
yes.
With high blood pressure, when patient comes, they tell me that who suffers from high blood pressure. All right, he said, I have this headache, and so I asked, where is the headache?
Yes.
They would say, well, it's on the side of the head.
Yes.
Some people say it's on the top of the head.
Yes.
Some people say it's on
The
the
back.
back
Yes.
of the head. So based on that description made by the patient on where the headache is, I would have some idea of what particular meridian is actually where the flow of the qi is actually affected.
Oh, so what you're doing is by asking the question, by specifying the spatial locations and how the sort of the location was sort of the pain or whatever complaint sort of happening, how it happens, you were able to identify which meridian was affected.
Affected, yes.
And so, how do you explain this to your patients? They would say, "What is meridian? Why do you asking all these weird questions?"
So, well, so I use um, both the language of Western medicine
Yes,
and Chinese medicine to explain it.
yes.
Because there are some patients who say that when I tell them that you are having some problem with your gallbladder meridian, they will say, "But Ray, I don't have any gallbladder anymore."
Yeah, it's removed or had a surgery, removed it.
So,
Yeah, yeah.
so that's so I explained back. Look, in Chinese medicine, when we look at the internal organs,
Mhm.
we look at it in the same way as a Western doctor looks at it. They are actually real organs. But in Chinese medicine, the inner organs also have, they emit a type of energy
Ah, yes,
called qi.
yes.
And this emission of this energy, if it emits, if it flows harmoniously in all those meridians, then the patient will be well. But if they are
Oh.
deranged or they become blocked, the flow of the qi in these meridians from the internal organs, then symptoms can arise.
So how do you resolve the question that if that specific organ is absent, but the meridian is still there, right?
Well, this is the big difference
Yes,
in
yes,
the philosophical outlook of Western
yes,
and Chinese
yes,
medicine.
yes,
In
yes,
Western medicine, there is, because of the influence of Descartes,
yes,
uh, most biomedical practitioners, they see a separation between the mind and the body,
yes,
or the Xin
yes,
and the Ti,
yes,
or something like
yes,
that.
yes.
Now, in Chinese medicine, we don't do that. We don't make any separation. When we look at the qi, the flow of qi and blood in the body, we do not say that, well, the qi and the blood only flows on the brain and it doesn't flow on other
Mm.
parts of the body. We say that this qi and blood flows along the whole body, and
Mhm.
also it flows on the atmosphere in the external in the external world.
Yes,
And,
yes. This
so
is
this chi is made up of the air that we breathe,
mm, mm, mm.
the chi that we get from our parents, and the good food and water that
Yes,
we have.
yes,
So that
yes.
is the components of this chi.
So that was the what you're looking for. So that was what you're looking for in a patient and how you talk to the patients. So when you sort of made a diagnosis and then sort of make up a plan to treat. So how do you explain that to a patient?
Okay, so let's continue with the example of somebody who suffers from sciatica,
Yeah,
which in Chinese medicine is said to um, um, is a manifestation of a disruption in the flow of the qi and blood
yeah,
along the gallbladder meridian.
yeah.
So once I have made that diagnosis, then I will work out with the patient
Mhm,
what sort of therapy and measures
mhm.
I will use in
Yeah,
order to deal with the condition of
yeah.
pain on the back, headaches, and all those other pains, reflecting the derangement of the gallbladder meridian chi.
Yeah. So what you're telling them will be like, I'm going to, sticking noodles on certain points,
Yes.
and you're also going to give them a formula of herbal medicine.
No.
No.
So what I do is that um, I will work out what sort of acupuncture points that I can use
Yes.
um, to deal with that particular condition.
Yeah.
And then I will also explain to the patient why I'm actually using those points at that particular time of the day or night.
Oh, I see.
So, and this is what is called in Chinese as the system of acupuncture called 子午六柱,
Oh, I see. Yes.
which is chrono acupuncture. That's
Yeah.
how I
Yeah.
translate it.
Yeah. Yeah.
So with this gallbladder patient, gallbladder qi derangement patient, qi derangement patient, I will choose certain points along the gallbladder meridian.
Yeah.
So one of those 2 points that I'm going to acupuncture point that I'm going to use is gallbladder 41.
Oh, okay.
Which is on the dorsal side
Yes.
of the foot.
Yes.
And then I will also use a point along the triple burner meridian.
Oh, yes.
Which is called I think triple burner meridian 7, I think, which is called Wai Guan.
Wai Guan. Yes.
And then the other one is Zu Lin Qi.
Zu
Lin Qi.
Oh.
And then I would tell the patient to come at a particular time during the day or night when I can actually use these 2 pairs of acupuncture points.
That actually raises another question I haven't planned. That is the timing.
Yes.
Because when you say 子午流注, it actually is kind of if my understanding is wrong, you just tell me. My understanding is that the qi flow into different places during the different time of the day. So to get the most of the acupuncture treatment, you need to stimulate that point at the most appropriate time or most beneficial time.
Optimal time.
Optimal time. Yes, the most optimal time. And that's when you say you ask the patient to drop in a particular time. Does it also change, say, if you are according to seasons, or is only the day?
Well, this is a very interesting question about season. You see, that is the thing about Chinese medicine. When I arrived in Australia, 40 years ago,
yes,
I found out that when it is winter here in Melbourne, in Australia, it was actually summer in China or in the US. So, and then I read from some of my classical books on TCM, like the Huangdi Neijing.
Yeah, they don't know you're going to practice in Australia.
It's the Yellow Emperor's classic on internal medicine. I found out that, because the Yellow Emperor always says that you do everything in Chinese medicine in accordance with the flow of the season.
Yes.
So I said, well, what I learned in Beijing was that, season is that
it's completely opposite.
Winter is actually around December and then January and November.
Yes.
But when I was in Australia then, well, it was actually summer.
Yeah.
So how can I practice Chinese medicine in accordance with the flow of the season in the southern hemisphere? So at that time, I thought long and hard about how to do this. So I looked at those Chinese calendars.
Yes,
you
the
see
chart, the seasonal changes. Yes.
No, it's a daily thing wherein you tear one side of the calendar once the day is over. I
Yes.
saw those calendar, and then they say that it's actually winter at that time. And then now, but I know that it is summer in Melbourne. So I thought I have to look at how I can develop
Yes.
a Chinese calendar suitable to the flow of the season in the Southern Hemisphere.
Right.
So that was in 19, I think that was in 1996, I think, when I started to um, to draw up a plan to develop a Southern Hemisphere Chinese calendar.
Wow, that's amazing.
Yes.
I remember in one of the conference you were kind of, handing out those
I
charts.
know.
Yes.
Oh, you remember that? So
Yes.
yeah, so that was it. And
Wow, that's
so
really good.
now I have developed I think 14 or 15 editions of the Northern Hemisphere Chinese calendar and the Southern Hemisphere Chinese calendar.
Wow.
And I'm using this in um, uh, using this in the practice of chronoacupuncture
Mhm.
here in Melbourne,
Wow.
because this calendar that I'm using is based on the time zone here in Melbourne.
Oh, that's absolutely wonderful. Thank you for answering all these difficult questions.